Today on 21st Century Medicine, dental implants. They're quite the rage today. But is this procedure right for everyone? Well, we'll be discussing this and many other fascinating aspects of today's modern dentistry with our special guest, Dr. David Mine, today on 21st Century Medicine. Hello and welcome to 21st Century Medicine. I'm your host, Deborah Ball. My guest today is one of Miami Beach's most distinguished dentists and the author of the book, Understanding First-Class Dental Care, Dr. David Vine. Dr. Vine, welcome.
Thank you, Deborah.
Dr. Vine, I've heard someplace that you're in the smile business, so what exactly does that mean?
Well, Deborah, our teeth are very important to our lives. From a mechanical standpoint, they allow us to eat and chew our food. And from a cosmetic standpoint, they're one of the first things people notice about each other.
Well, I know that that's absolutely true.
So with that in mind, people require healthy, well-functioning teeth and also seek an attractive smile.
Sure. So people want to be confident when they smile.
Exactly.
What gives them that confidence, though?
It's generally accepted that people are seeking a smile with teeth that are clean and white with a broad and confident smile.
And I know there are many new ways to achieve that today.
That's true, but I must hasten to add that in my practice I place a great deal of emphasis on the preservation of your original teeth.
Sure. Well, I know that we have some examples, so let's go ahead and take a look at our first one.
This is an interesting case because it demonstrates a number of things. This South Beach model came to me for cleaning. We performed a complete examination, and I noticed what appeared to be a few small areas of decay. Upon excavating one of these areas, it was apparent that this small area is quite large. Utilizing high-powered magnification allowed me to carefully dissect the decay while preserving as much tooth structure as possible. This avoided the need for a root canal and a more costly restoration such as a crown or an inlay.
So it would seem that she came to you just in the nick of time, really.
Yes, and it's really important for people to have their teeth checked regularly by their dentist.
So how often is that really necessary?
Having a checkup every 6 months is generally suggested.
You know, I know sometimes people are afraid to go to the dentist because they think it's going to hurt.
Yes, but this is in fact counterintuitive. Today's modern dentistry techniques make for virtually painless dentistry. Procrastinating your dental visits only makes the restoration process more lengthy. Again, it's very important to take good care of your teeth.
Well, let's take a look at another example here.
Here we have the before and after of a young lady who sought a more confident smile. When attempting to restore teeth for a maximum aesthetic result, consultation with a laboratory technician is crucial. Utilizing full crowns rather than veneers allows the technician to layer the porcelain shades appropriately and not make the teeth appear too bulky.
Wow, you know, that's really remarkable. What a beautiful job.
Thank you.
Well, let's see another one. Let's go ahead and take a look at another.
This young girl was brought to my office by her father. They were visiting from Dubai. The father was concerned about the possibility of permanent teeth shifting as a result of the loss of this baby tooth. This was a good question. Many times premature loss of a baby tooth can result in a future malocclusion. Space maintainers made by the dentist function to prevent this problem. In this particular case, after reviewing the x-rays, it was apparent that the permanent tooth was erupting normally and no space maintainer would be necessary.
Well, when should children first be seen by a dentist?
Today it's thought that they should be seen approximately the first year. And the reason for that is the pediatric dentist wants the young child to become familiar with the environment.
Oh, sure, of course. Well, let's take a look at another example.
Residual infection following root canal therapy can result in a chronic abscess. This abscess can burrow through the bone and drain through what is called a fistula. Now, a lot of times people will go in and have a root canal done and they think, well, that's the end of it, the root canal's finished and I won't have any more problems. And it's not always the case. Sometimes it's very difficult to find all these little canals, and especially at the end, the apex or the end of the root.
Yeah.
And if the infection or debris is not removed, sometimes they can develop this abscess. Here, a gutta-percha point is inserted within the fistula to indicate where the origin of the infection is located. In other words, a lot of times a patient will come in and they have a little fistula in the side of the mouth, but you can't really know what tooth it's coming from. So we put the gutta-percha in and it kind of points to where the apex is. So an x-ray is then taken to show the relationship of this gutta-percha point to the offending root.
Well, tell us all what gutta-percha is.
Gutta-percha is a naturally occurring substance that's an ideal agent for filling the root canal space. Once the correct diagnosis is established, an apicoectomy can be performed. The end of the root is cut off and the diseased tissue is removed, and a filling is placed to seal the remaining root opening, and the area is sutured closed.
Well, how do you know that you finally eliminated the problem?
Well, most of the time, the tissue will heal uneventfully, and everything will be fine. And clinically, that indicates that the problem is basically solved. And the debris that we take out from this area is then sent to a pathology lab, and that helps establish the diagnosis.
And this patient was cured?
Yes, the patient subsequently had normal healing.
Right. Dr. Vine, it would appear that you perform many challenging procedures at your office.
Day in and day out.
Well, let's take a look at another one.
Here's a gentleman who presented with a fractured amalgam restoration.
Amalgam restoration, that would be a silver filling, right?
Right. Yes, his treatment involved removing the fractured restoration and recurrent decay, as showed in the intermediate photo. The final restoration was achieved using a bonded composite material. This is an interesting case because with the amount of tooth structure needing to be restored, a more durable restoration would have been a full crown. Well, this would have involved more cost and time for the patient. However, ultimately, it might have been the therapy of choice. And Deborah, in a situation like this, if you are going to perform a crown restoration, you have to stop your procedure and take an impression and send it to a lab, and you have to send it to a good lab. So that takes time and money, and the difference between doing that and the direct restoration is the composited plate is placed at that appointment.
So it sounds like sometimes you have more than one way to solve a patient's condition.
Many times, and carefully evaluating each and every patient is critical to achieving an outcome that is tailored specifically for them.
Well, that's very important. Well, while we're on this subject, what's the story with the silver fillings and toxic metals like mercury? We've heard so much about that.
Silver fillings are really what's referred to as an alloy, or a combination of metals, including minute quantities of mercury. Well, the controversy exists regarding the toxic nature of mercury. However, according to the American Dental Association, no evidence of this has ever been determined.
So how does a patient know what to do about these fillings?
I've included information about this subject in my book, Understanding First-Class Dental Care, or patients can call my office anytime.
Right. Well, I know we'll be getting a lot of questions, so let's put up the numbers on the screen. And when's the best time for patients to call you, doctor?
Well, during the week, they can call in 305-538-1115, and if they have an emergency, they can call on my emergency line.
Well, I know in today's economy, people want to know how much their dental care will cost them.
Yes, I understand. We offer new patients a free consultation.
Free?
Yes, and we can usually predict very accurately the amount of work they will require and give them an accurate estimate.
Well, now I know we'll be getting a lot of calls, so let's put that number up again. My guest today is Dr. David Vine, renowned Miami Beach dentist and the author of the book, Understanding First-Class Dental Care.
Hello, I'm Dr. David Vine. I've been practicing dentistry for over 35 years, and I am the author of the book, Understanding First-Class Dental Care. Back in 1972, I graduated from the Baltimore College of Dental Surgery, University of Maryland. Fresh out of school, I was excited with the prospects of living life for the first time, not as a formal student of the educational system. I moved to Boston, Massachusetts, where I secured a job as an associate in a dental practice. Over the years, as I discovered and learned the lessons of life, both professionally and personally, I came to a better understanding of how to live a more successful life. The road has not been easy. And how does this brief history translate to the nature of my dental practice today? It means that when you come to my office with your dental concerns, you will benefit from my years of study, and you will be treated as a unique individual with respect and empathy from myself and my staff. As a dental professional, it is up to me to evaluate your dental condition and advise you of your options, not to dictate a treatment. Experience has taught me that not all conditions need treatment, and no one has a perfect mouth. Over the years, as part of my continuing education in dentistry, when a patient needed to see a specialist, whether it was a periodontist, an endodontist, an oral surgeon, or an orthodontist, I went with the patient for the appointment. This was important not only for the patient, but so that I could learn these procedures and not only perform them, but improve my diagnostic skills. Developing this knowledge has given me more confidence, and it's a nice feeling to know that the patients that are coming to me for advice are getting up-to-date, straightforward information. I can't say that I'm the best dentist around. Our dental educational system in the United States is great, and those dentists who took advantage of the education and continued learning and growing are out there providing excellent services. I can say that conferring with the best dentists and specialists that I know has given me the ability to provide first-class dental care. I hope you've enjoyed this presentation, and if you have any questions regarding your dental needs, please call my office or stop in for a free consultation. My office is located in the center of Miami Beach at 400 Arthur Godfrey Road. Thank you.
Let's take a look at another example, doctor.
This is an example of major full mouth rehabilitation. The key to success here is proper initial treatment planning. We were able to restore his mouth without the need for dental implants, therefore eliminating multiple surgeries. Now, regarding dental implants, there's a lot going on in utilization of dental implants, and there's a lot going on in terms of overutilization of dental implants. And they're very good when used appropriately. For instance, in a situation where a person has a tendency to get recurrent decay, an older patient comes in and needs crowns replaced because of recurrent decay. A lot of times you can put new crowns in and they're going to get recurrent decay around the new crowns also. And the advantage of a dental implant in that situation is they will not decay. In this particular case, though, we were able to restore his mouth without utilization of dental implants, and the process was time-consuming because there's no quick fix if long-term results are to be attained. And attention to detail, utilizing the best laboratories and materials is mandatory.
What an astounding difference. Let's look at another one.
This attractive young lady from London was referred from a Miami Beach hotel. She complained of a loose front tooth. This tooth had previously dislodged due to a non-retentive metal post. And what we're doing in dentistry today is with the advancement in new technologies and new materials. When I went to dental school 35 years ago, we used gold or metal post routinely. Dentistry is a conservative profession. I don't like to change unless they know that a new system is going to be better. We're using carbon fiber posts now, and it eliminates the need to take an impression and have a laboratory make a cast post, and they work really well. So in her case, we used a carbon fiber post in order to support a new crown. The root was prepared for the placement of this particular post, and once the post was bonded in place, a core material was bonded to the post. An impression was taken and sent to the laboratory for the fabrication of a final all porcelain crown. And that's something also that's a breakthrough. Porcelain is a very fragile glass material. And 10 and 15 years ago, we were not using all porcelain restorations. They didn't have the strength. But now they've developed really hard cores, which make them more aesthetically pleasing and very durable. So we're using these particular all porcelain crowns now. In her case, a temporary crown was fabricated during the period of time the lab was making the final crown.
So the person is able to leave the office intact, so to speak.
Of Of course.
How long does it usually take for the lab to make the actual tooth?
I have a great lab that sometimes working with me on emergencies like this was able to make the tooth in a few days.
Wow, then what happens at that point?
When we get the permanent crown back, we check it carefully, make sure the bite's correct, make sure that it fits well. In this case, we determined that there was an open margin on the inside of the crown. Well, if that's the case, then cement can wash out. So what we did was we sent this back to the laboratory, took a new impression, and the laboratory fabricated a new crown, and it fit perfectly.
Well, that sounds pretty amazing. I've heard that margin discrepancies are quite common.
My laboratory technician told me that I take good impressions, and I hope I do, but he said that that's not the case with a lot of the work that he sees, and about 80% of the cases that he sees, he says he wouldn't put those crowns in his mouth. Now, why is he producing those crowns and sending them out? Well, he's a laboratory technician, he's doing the best job he can. But the reality of the situation is these margins or these crowns are not always to the extent that they should be in terms of fit.
But it sounds like you're very conservative and very particular about the materials that you install.
Very much so. If it's not 100% right, it's not going into my patient's mouth.
Exactly, that's important. Well, let's go ahead and see another.
Prior to development improvements in implant therapy, this space would have been corrected with a bridge.
Sure.
The teeth on either side of the space would have been prepared for crowns, and a false tooth would have been attached to restore the missing tooth. That's called the 3-unit bridge. Initially, this patient had inadequate bone to properly place an implant, and that's one of the key aspects of implant placements. It's not that easy. Patient doesn't come in and all of a sudden just pop an implant in. They have to have enough bone around that area to support it.
So in this patient's case, what did you do?
Well, in this case, it was referred to a periodontist who expanded the bone at the time of implant placement.
Oh, wow.
And with this bone expansion technique, it helped avoid having to place a bone graft, and therefore this saved the patient the time and the money involved in that other procedure.
That's wonderful, and we all want to save lots of time and money. Let's take a look at another example.
Here's something we often see in the office. This patient has a buildup of tartar, and the before and after shots demonstrate the plaque and the tartar accumulation. And that's why periodic cleaning appointments are necessary in order to maintain healthy teeth and gums.
How long does it take to do a job like that?
About an hour.
Well, that's not bad at all. Well, let's take a look at another.
This patient came to me with deteriorated upper and lower full dentures. The poorly filling dentures had caused severe problems with the underlying supportive soft tissue. And this is an interesting fact also. When dentures are made, the patient walks out and they say, okay, I got new dentures, everything's fine. But these things have to be checked periodically because over time, the bone under the denture will resorb. And if the dentures are not relined and if they malfunction as a result of this change of underlying structure, then you can get this buildup of redundant inflamed tissue. Sometimes this goes on for years. And in this particular situation, it was really bad. So he was referred to an oral surgeon to correct this condition, and temporary dentures were fabricated during the healing period. At that time, the oral surgeon excised or removed this excess tissue. And the final dentures were fabricated after the healthy tissue was evident. He's very happy with his much improved condition. And many patients like him function very well with properly constructed dentures, and therefore avoiding the time and expense of dental implants. Dental implants have now become very effective in supporting dentures. For instance, dentures basically sit on soft tissue. So you take a denture and you can maybe put 2 implants under the denture and they can snap onto the implants, and that's a very effective means of improving the stability and functionality of the dentures.
Wow, that's really quite remarkable. Folks, you're watching 21st Century Medicine. I'm your host, Deborah Ball, and today our guest is Dr. David Vine. Dr. Vine, if people want to learn more about your book or have questions about their teeth, what should they do?
They're welcome to visit my website, www.davidvinedentist.com, or they can always call the office.
Let's show those numbers again. Dr. Vine, let's look at another example.
Dental neglect over the years resulted in this deteriorated state. Proper treatment planning is always the basis for successful results. In this case, following extraction of hopeless teeth, removable dentures were fabricated.
Well, could this patient have had implants instead?
Yes. but it would have been more costly, it would have been more time consuming, and she was very happy with the result that we got, and it was less expensive than it would have been with implants.
So this is another instance of tailoring the exact treatment needed to suit the actual patient's needs.
Exactly.
So what's next?
This patient presented with significant pain. Clinical examination and examination of the x-rays showed an abscess within the bone above the upper right lateral incisor. Her pain would have been eliminated had the abscess resulted in a draining fistula, as was seen in the previous case. Due to previous traumatic dental episodes, she was quite phobic, and her overall dental condition was quite poor. In this particular case, an apicoectomy surgical procedure was performed. Though the resected root segment was quite small, about the size of a pinky fingertip, it caused a painful reaction. And root canal therapy, as we said before, even if performed with diligence by a specialist, can still fail and require this type of surgical correction. When you're looking at an x-ray, the infection appears as a radiolucent or dark area at the end of the root. And this is the result of the bone being resorbed by the infection.
It's interesting. Well, it looks like a lot of work.
We deal with cases like this on a regular basis.
Really? Let's take a look at another one.
This lady came to my office as an emergency patient. A porcelain veneer had dislodged from her central incisor. This is a good example of the improper utilization of a porcelain veneer. Everyone wants beautiful teeth, and you see all these advertisements in terms of porcelain veneers, and like anything, it has to be done properly. And with these newer types of porcelain veneers, it's advertised that they're so thin that the dentist doesn't have to remove any tooth structure and therefore doesn't have to administer anesthesia. And that isn't always the case. You need a certain depth of porcelain for the laboratory technician to create the aesthetic result with the layering of the porcelains. And also, as in this case, these porcelain veneers can pop off if they're not properly cemented to the teeth. And this particular tooth should have been restored with a full crown restoration. Her emergency therapy included removal of the recurrent decay and bonding of a composite material.
And the composite material is the white, tooth-colored material. It really is a dramatic difference.
Yes, and though she was very happy with the instant result, the aesthetics on this case are far from perfect. She has residual stain on adjacent teeth due to leakage around the margins of other veneers, and the adjacent porcelain veneers are too opaque and they lack vitality. Improvements could be made with full crowns and a laboratory technician that knows how to layer the different porcelain substrates.
So the restoration process can be an ongoing effort, it sounds like.
Yes, good dental care is a continuing process that we need to maintain over our entire lifetime.
So Dr. Vine, it seems that you perform many complicated procedures. What if somebody just wants something simple, like getting their teeth whitened or something?
Yes, of course, we offer some of the most advanced techniques for whitening teeth that are available. I have mixed feelings in terms of utilizing these systems because, of course, manufacturers want to sell their products, but once a dentist has it in his office and is actually treating patients with these one-hour systems, we're finding out that the results are not as dramatic as the manufacturer might indicate, and some people are very, very sensitive to the process. So you got to pick your patients carefully, and the dentist has to be aware of what works and what doesn't work so they can advise their patients appropriately.
Well, Doctor, this has been a really fascinating look at the level of work that you routinely perform at your dental practice on Miami Beach. Where exactly are you located?
We're located at the Sheridan Center, which is 400 Arthur Godfrey Road.
Oh, that's near the Forge, right?
Right next to the Forge.
Oh, I love that place. Well, how's the parking around there?
We have free valet parking.
Really? That's very nice. We all know the parking is one of the hard things to do on
Not at my practice. Hello, I'm Dr. David Vine. I've been practicing dentistry for over 35 years, and I am the author of the book, Understanding First-Class Dental Care. Back in 1972, I graduated from the Baltimore College of Dental Surgery, University of Maryland. Fresh out of school, I was excited with the prospects of living life for the first time, not as a formal student of the educational system. I moved to Boston, Massachusetts, where I secured a job as an associate in a dental practice. Over the years, as I discovered and learned the lessons of life, both professionally and personally, I came to a better understanding of how to live a more successful life. The road has not been easy. And how does this brief history translate to the nature of my dental practice today? It means that when you come to my office with your dental concerns, you will benefit from my years of study and you will be treated as a unique individual with respect and empathy from myself and my staff. As a dental professional, it is up to me to evaluate your dental condition and advise you of your options, not to dictate a treatment. Experience has taught me that not all conditions need treatment and no one has a perfect mouth. Over the years, as part of my continuing education in dentistry, when a patient needed to see a specialist, whether it was a periodontist, an endodontist, an oral surgeon, or an orthodontist, I went with the patient for the appointment. This was important not only for the patient, but so that I could learn these procedures and not only perform them, but improve my diagnostic skills. Developing this knowledge has given me more confidence, and it's a nice feeling to know that the patients that are coming to me for advice are getting up-to-date, straightforward information. I can't say that I'm the best dentist around. Our dental educational system in the United States is great, and those dentists who took advantage of the education and continued learning and growing are out there providing excellent services. I can say that conferring with the best dentists and specialists that I know has given me the ability to provide first-class dental care. I hope you've enjoyed this presentation, and if you have any questions regarding your dental needs, please call my office or stop in for a free consultation. My office is located in the center of Miami Beach at 400 Arthur Godfrey Road. Thank you.
Okay, well folks, we're out of time, but my guest today has been renowned Miami Beach dentist Dr. David Vine, who's the author of the book Understanding First Class Dental Care, and who's been performing miracles for his patients for many years. If you wish to contact Dr. Vine, you can call him at his office at 305-538-1115. And if you have a dental emergency after hours, you should call his emergency line so he can assist you. And you can always visit his website at www.davidvinedentist.com. Dr. Vine, thank you so much for being my guest today on 21st Century Medicine.
It's my pleasure. Thank you, Deborah.